Hi, everyone. Welcome back to Staying Compliant with KW Advanced Consulting. My name is Keisha Wilson. I'm the founder of KW Advanced Consulting. Thank you for joining today. Thank you for liking, subscribing, and staying tuned. So today I want to talk a little bit more about telehealth. We talked about it last time, but I wanted to talk about supervision, the direct supervision, because in the final rule for 2026, CMS had changed the definition when it comes to direct supervision and has now permanently allowing for direct supervision to be conducted virtually, meaning audio and video. And so this affects a lot of different services. Um, for those that are doing incident two, that's number one on the list. And as an auditor and a compliance officer, that was like the first thing that went off in my head, like, oh boy. Because I know incident two can give us gray hair. It has given many people gray hair over the last few years, even trying to get providers to document appropriately and provide incident two services compliantly when they had to be in the office. So if you don't know about incident two incident two services is furnished in the office setting. And that's when the physician has already seen the patient, a new patient, created a plan. And now when the patient comes back, if they're seeing the APPs or NPPs, meaning physician assistants, nurse practitioners, they are following an established plan. So incident two services are provided for an established patient, for an established plan of care. If a patient came in with a new problem, they had to be seen by the physician to now create another new plan. Now, keep in mind, physicians see the patients, they get paid at 100%. If they are seen by the nurse practitioners, PA, they are actually credentialed. If you credential them properly, they are credentialed and they are billing providers and can bill to see patients on their own. But the reimbursement rate is 85%. So incident two, it's being billed under that initial physician. And the APPs or NPPs are seeing the patients incident to the provider's initial service and plan. So they're following a plan. If there's anything that's new, the provider has to now create a plan. The physicians also had to be immediately available in the office, right? In the office setting, office suite. They did not need to be in the room with these APPs seeing the patient, but they had to be readily available. So that means that if that provider was scheduled for surgery and they're conducting surgery, they are not readily available, and those services should not be billed under that provider. Now, if it's a group practice, someone else in that group can provide supervision to that patient, and it can be billed under there. Documentation should also state that. So it was very sticky because there was a lot. You know, if you go on your max when it comes to incident two, your Medicare administrative contractors, a lot of them have guidance on how to bill incident two. It has one that has been audited many times. It's high on the list of auditing services. When I worked in the hospital settings, we did pop-up visits to to those different departments that were billing incident two to see if the providers were there. So that was already stressful, right? And now they're saying that we can conduct these direct supervision virtually. You cannot conduct it audio only, so that provider has to be readily available and it has to be audio and video. So it has to be both. And for diagnostic services as well. Now, when it comes to the teaching physician setting and those teaching hospitals or offices, CMS has said that the providers can continue to provide direct supervision virtually, audio, video, in the teaching physician setting. But those visits that the residents are conducting must already be taking place virtually. So keep that in mind, right? It has to be virtual to provide that virtual supervision. If it's in person, right, they have to be there in person. It cannot be audio only as well. So you want to make sure that you're paying attention. You want to make sure that you're getting audit ready. So when it comes to documentation, your documentation should state how supervision was provided. So now, as a consultant, when I'm called in to audit records, I am going to be looking at the documentation to see if this was provided virtually. What platform did you use? You also want to mention that, and that this doctor, Dr. Smith, provided virtual supervision utilizing, whatever platform it is, and also that you were there. They want to make sure that the physicians were there for the key portions of the E&M, because they are billing for these services saying that you saw the patient, right? And so just like we did E&M services, and in the teaching physician setting, they had to be there for the key portions of an evaluation and management service. It's the same thing. They must be there for the key portions of the evaluation and management services when it's being provided virtually as well. So you want to make sure you're paying attention to that. Also, they also excluded major surgeries or surgeries with a 10-day to 90-day global period. Those providers, their physical presence is still required in person. So supervision cannot be done for 10 to 90-day global period surgery. So you want to keep that in mind too. So yes, direct supervision change when it comes to the practitioner. However, you'll want to look at what's allowed and what's not allowed. CMS came out with an updated FAQ on February 4th, 2026. So you definitely want to take a look at the FAQ. I will link that below so that you can review it and pay attention to the questions or questions and answers, right? So right here, you would see question number 7. What are the current guidelines for virtual presence for teaching physicians who furnish telehealth services involving residents? And it says in the calendar year 2026, the final rule, right? We're talking about the physician fee schedule. We established the beginning of January 1st, 2026. We are continuing to allow teaching physicians to have a virtual presence in all teaching settings, but only for services furnished as Medicare telehealth services. How do you find that? You go to the list on CMS website, and they have the list of services that are allowed for CMS. List has continued to be updated. So you want to make sure that you're downloading the most current year. In addition, it says this will continue to permit teaching physicians to have virtual presence during the key portion of Medicare telehealth service for which payment is sought through audio-video real-time communication technology for all residency training locations. All residency training locations. So that's important. So for those in the teaching hospitals, primary care exceptions, that is the guidance, right? So I will link this below, and make sure that you are becoming audit ready for 2026. Put incident 2 on your compliance plan to look now that they are allowing the provider supervision or the supervision to be conducted audio and video. You want to make sure your documentation and your templates are supported. Should your organization need education on telehealth, on direct supervision, you need a compliance, you need someone to come in, a consultant, and update your templates or help you create policies around this, feel free to reach out to kwadvancedconsultant.com. The contact us page. We'll be happy to have a consultation with you and come to your organization. Thank you so much. I hope you like, subscribe, and share, and stay tuned for our next video.